Doris. News item. Between 1953 and 1964, the U.S. Central Intelligence Agency, CIA, then deep into the international psychosis of the Cold War, through its MK-Ultra program, experimented on unwitting human subjects, hoping to develop mind-control drugs. None then dared to call this program illegal torture. In fact, in 149 projects, CIA had the cooperation of 15 research foundations and chemical and drug companies, 3 prisons, 44 U.S. colleges and universities, and the participation of 12 clinics and hospitals. When I knew her, my first wife's mother, my first mother-in-law, Doris Bell Twig Krause, roamed her home in Annapolis, Maryland, like a silent, fearful ghost, a mere shadow of the bright, hopeful young woman she had been 20 years earlier. Crazy, people said. Perhaps not the whole story. In severe postpartum depression during the late 1950s, committed to Spring Grove State Hospital in Baltimore. A not uncommon fate then, especially for women judged too uppity by their men, locked into what should have been safe haven, a true asylum. At Spring Grove, however, her family learned later, Doris was likely given LSD by the spooks and unconscionable cold warriors, and as a severe neurotic, was subjected to hours of consciousness warping and hallucinations. Dr. Charles Savage, director of medical research at Spring Grove in 1969 and professor of psychiatry at Johns Hopkins, touted LSD as psychotherapy. Never mentioned the CIA's desire that it would prove to be a deadly weapon, nor the terrible human casualties of that agency's then secret, mind-boggling research. Doris Bell went home to Rome, fell mostly silent. If mad, apparently had plenty to be mad about, and yet would not tell her 4 children, her philandering man, the 2 dogs in the yard. Would never speak of the unspeakable, except with those dark, intense, darting eyes. But the eyes definitely had it. Testified she was back from hell.